Thank you so much for all coming. I'm very excited to be talking about my research. Been working on it for a long time. I am going to be, my talk is on the predictors of birth center sustainability in the United States. I am a nurse midwife. My background has been in working in birth centers. You'll see my background is Costa Rica. I really want to ground this research in real life setting. It's not, I don't want it to be just an academic study. My grandmother was one of 13 children. My mother is from Costa Rica, and my grandmother was, that midwife that she actually had 18 births. 5 of the children died in childhood. But this is a study that's grounded in the US, but the issues that I'm going to be talking about are pretty much worldwide. And I want to always keep that in the back of our minds. My dissertation committee is Dr. Lavin, Dr. Barger from University of San Diego, Dr. Kelly, and Dr. Parshall. So I'll start with the background of my study. This is the current state of birth in the US. We have a very high maternal mortality rate compared to other developed countries. Ours is at 14. You can see other developed countries, Switzerland, Australia, United Kingdom. We do have a diverse population in the US, but even these other countries, they do also have a very diverse population, and yet they are able to get much lower maternal mortality rate. Our C-section rate in the US is 1 in 3 at this point, our average C-section rate, but even for low risk women who are just a single birth, vaginal, head down, everything normal, you still have about a 20% chance of having a C-section. You can see that the C-section rate in the US has been going up rapidly since 1996 to 2009. And since 2009, the rate has pretty much plateaued. There's been a lot of attention paid to try to get these rates down, but it's very high. And the World Health Organization is really saying that a C-section rate over 10%, you're not finding any increase in maternal well-being metrics. So, our C-section rate is really high in the US, and it's something that's really concerning because it affects women, their families, and you have a higher rate of complications. Of course, a C-section is good when it's really needed, but a C-section rate of over 30% is unusually high. These birth statistics are also grounded in a setting where costs are extremely high in the US. Just a normal vaginal birth is costing the whole system about $32,000 a year. And a C-section is going to be over $51,000. Even insurance is paying for a lot of that, but even after insurance, a woman and her family can expect to pay, like $3,000 if it was just a completely normal birth. And you can see how this compares to other countries where their total costs are fantastically lower than ours. So we're having high maternal morbidity rates, not great. Our preterm birth rate is also around 10%, and we're paying all this money and we're not really getting anything for it. So one of the alternatives to doing birth the way it's been done in the past, 50 years in the US is a birth center, a midwifery model of care. It's a home-like setting. Midwives provide family-centered care to healthy pregnant women. And there's been many, many studies, which I have listed at the end of this presentation, of the health outcomes of low-risk women in birthing centers. And they're really good, if not better than what's in a hospital. Typically, even if you have to transfer from a birth center, the C-section rate is lower than if you had started out in hospital care. So, with all the good clinical outcomes and the cost savings of birth centers, my question was, well, why don't we have more birth centers? So I was trying to see, well, let me just go on. I don't want to jump my gun here. So this is, you know, what a birth center looks like. And I think a lot of people don't even understand what a birth center is because it's hard to conceptualize what it is until you actually see pictures. But it's a very kind of a homey place. They have all the equipment, resuscitation equipment, everything, but it's kind of hidden behind in closets. But it's trying to create a sense of community and belonging in someone so that the stress hormones that you sometimes may get if you're in a hospital setting, it's just gets all that out of the way so that you can really focus on just, you know, getting your birth done. So, you know, it's a very nice situation. And I mean, I'm not saying that midwives and there's many nurse midwives deliver in hospitals and they also do a very good job there. But a birth center is a whole different setting, and it is a really nice place. I had both of my daughters in birth centers. So what we do know about birth centers is that there's no standard birth center model. You have different operational logistics, which are unique to each birth center in its own setting. It's not necessarily lower cost because midwives do spend more time. They don't really get paid for the time they spend, but they should be getting paid more. So what I'm trying to see in this study is, you know, what organizational factors would help or hinder a birth center staying in business over time. It's not your typical business like you may look at other businesses in the US, because this is something that's really grounded in the community. And to develop that sense of belonging, you have to be in business over time in your community to establish those feelings of trust so that when women go there, they feel, okay, this is a great place for me to be in birthing my baby. So my study was looking at the factors of, you know, organizational factors in the model of care of birth centers. So looking at the frequency of organizational characteristics and then trying to determine which of these organizational characteristics correlated with greater financial sustainability. And then I tried to model which combination of organizational factors most strongly predicted the sustainability of birth centers. So now I'm going to get into the methods of how I tried to do my study. I used data from the AABC Profile, which is the American Association of Birthing Centers. This is the, it's a trade organization of birth centers. It's really the only people that are doing survey gathering on birth centers in the US at this time. There are 10 sections of the survey that they did in 2016, looking at practice and administrative factors of the birth center. At the time of the survey, there were about 300 birth centers and about 50% completed at least some part of the survey. The two maps on the bottom show, the one on the left is the number of birth centers that were in business at the time of the survey. And the one on the right is the response, the spread of the response from the birth centers that responded. So we had about a 78% response rate from those birth centers who are actual members of the American Association of Birthing Centers, but they were surveying all the birth centers that they knew of, whether or not they were members of the AABC. So I do think we had a pretty good response rate of the actual members, but you know, okay, so let's go. These are the factors that I focused on based on my review of the health policy literature. I looked at the average number of birth center births per year, whether or not a birth center carried some form of liability insurance, whether or not they were accredited either by the Commission for the Accreditation of Birth Centers or by the Joint Commission, where they were located, whether it was in a rural or small town or a suburban or mixed environment. You know, I looked at their business model, whether they were being run as a for-profit or as a nonprofit, and whether their length of time in operation, whether they were less than 3 years versus greater than 3 years, and whether or not they had the availability to be licensed in the state in which they resided. So accreditation and state licensure are two different things. Accreditation is by other organizations. State licensure is really does the state provide a mechanism for that birth center to be licensed? And the outcome variable I looked at was financial sustainability. And this is an equally weighted composite of two factors that were on the survey. One question was on financial health, asking the birth centers, how did they feel they were doing right now? And then the other question was asking, how do you feel you've been doing over the past 5 years? So these are the different responses that they were able to give. And I grouped these two factors together into one concept of financial sustainability. So I had 3 outcome categories then. The birth centers that were doing really well and were consistently or very consistently doing well over the past 5 years, I put into an excellent category. The ones that were doing good, but not always consistently good, I put in a good category. And then the birth centers that said they were not doing well and they really hadn't been doing well, either consistently or not consistently over the past 5 years, I put in the poor. Because, if you're not doing well, and it doesn't matter how long it's been, but if you're just not doing well, you're not going to be able to be sustainable in the long term. So I did 3 types of, well, I actually did a lot more than this, but this is what I've narrowed it down for the purposes of presentation today. But 3 statistical analyses focusing on just looking at the descriptive frequency statistics of birth center organizational characteristics. I then did bivariate analyses looking at which individual factors seem to correlate with financial sustainability. And then the multinomial logistic regression, I was modeling which combination of these factors. I used different statistical packages for each of these types of analyses, mostly SPSS for the descriptive and the bivariate, and R for some parts of the bivariate, because I did use a Fisher's exact test and I had to do those in R. And the things I needed to do with multinomial logistic regression, I could only do in R. So I used R and I used a new function that's been just recently put on called the BR multinome. And now I'll talk about my results. So this is a busy slide, and I will kind of focus on the most important things on the next slide. But this is basically all the data that I was getting from all these different variables. These are the predictor variables. And so the main points I'd like to take away from this is, hold on for a second, is that most of the birth centers who responded had been in business for more than 3 years. Most of them were also being run as for-profits, which kind of surprised me because you hear a lot about nonprofits, but actually a lot of them are being run as for-profits. There was no state licensure available at the time of the survey in 18% of them. Very high liability insurance coverage, about 67%. A little over a third were located in rural and small towns. And I was kind of surprised to see that 40% at the time of the survey were not accredited by either the American Association of Birthing Centers. I mean, it's actually the Commission on the Accreditation of Birthing Centers, or the Joint Commission. And the average births per year were about 97. Oops. And this was the outcome variable. Again, looking at the 2 factors that were put together as financial sustainability. And the highlights of this slide are on this slide. So about almost 3/4 of them said they were consistently in good financial health. We had about 13% saying they were in good financial health, but not that consistently. And then almost 16% were saying they were in not good financial health over time. This is another busy slide of the bivariate analyses, and I'll focus a little bit more on the results on the next slide. So the individual factors just by themselves indicated that availability of state licensure and geographic setting were the most important ones that had, statistical significance with greater financial sustainability. Accreditation also, while not statistically significant, was in that group. All the other variables, all the other predictors were much farther away in terms of their statistical significance. Okay, so this is a very busy slide, and I don't want it to scare people. This is the code and the output for the R, programming in R. And the thing is, I have put a lot of, cut and paste a lot of things onto this one page. So I do, it looks a lot more complicated than it really is. And it's just a matter of getting familiar with it. It is a programming language, but it's basically, if you know the functions that you're just trying to use, and you're working with the statistician, and you maybe taking a workshop on R, all of those things I did, it isn't as overwhelming as it might look here. But anyway, here are the results on the next slide of the multinomial logistic regression using the BR multinom function. So this is with all the variables in the model. 3 predictors came out to be statistically significant: the availability of state licensure, those birth centers that were being run as for-profits, and whether the birth center carried liability insurance. The availability of state licensure was the relative odds of being in an excellent versus a good category were almost 8%, odds ratio of almost 8, compared to those in which states in which licensure was not available in that state that they were in, controlling for all other variables in the model. And then for the for-profit business model, their relative odds of being in a good versus a poor financial sustainability category were a little over 7, compared with those birth centers that were being run as a nonprofit. Liability insurance, it was statistically significant in the overall model, but the individual coefficients of the confidence intervals included 0. So we weren't able to determine which pairwise comparisons were statistically significant. So I'd like to discuss now what this all means. From the descriptive analyses, we could see that there was a lot of variation in the characteristics of birth centers all over the US. And that makes total sense, because there's different environmental contexts, different populations in each state, their legislative climate in each state is different. So that was to be expected. With the bivariate analysis, we found greater financial sustainability associated with being in an urban location and when state licensure was available. And accreditation may also be an important factor. The regression modeling indicated that the birth centers that were showing relative odds of greater financial sustainability when there was availability of state licensure, where there was a for-profit business model, and whether liability insurance was on board. So, we do know that birth centers have benefits in every major health metric. We have reduced rates of preterm birth and low birth weight, fewer cesareans, and lower cost of birth centers. We also know that we have incredible health inequities in the US, and especially Black and brown women bear a disproportionate burden of the higher hospital intervention rates. This is not biologic. These are extensions of historical context in which Black lives have been devalued. And there are many social and financial advantages of birth centers. And, I'm hoping that looking at these factors and thinking about these issues will motivate policymakers to help reduce these healthcare disparities and inequities. So research that we would like to know more about is like why, the fact that 40% of birth centers were accredited and the others weren't at the time of surveys, why aren't they all accredited? So it'd be interesting to find out why a birth center would seek or fail to gain accreditation. It is a very arduous process to be accredited. So it could be that those birth centers that are on better financial ground have the means to become accredited. But learning about these issues would help us, maybe ease accreditation for more birthing centers. And this could impact the viability of birth centers, and especially in underserved areas or in states where licenses aren't available. So some birth centers in those states that don't have licensure, they're using accreditation to build that consumer confidence. Other issues are that if you're in alongside a birth center in a hospital setting, those centers have been able to use accreditation as a pushback against the medicalization of birth in a hospital environment. So accreditation has a lot of good things going for it. We saw that both in the bivariate and in the multinomial logistic regression modeling, that state licensing was really, it stood out as one of those things that was statistically significant. So this points even more to the importance of trying to address these restrictive state licensing and regulations. And it's also these trade restrictions also affect the ability of nurse midwives to practice. If midwives can't practice in all full practice authority on their scope within the US, it's very hard for them to open up a birth center. So we had approximately 50% response rate. It'd be nice to have a greater response rate, but actually in looking at survey methods, this was an email survey sent out, and a 50% response rate is actually pretty good, because the average of email surveys is usually around 30%. So of course you always like a better one, but it's important, to put this in the context of the type of survey that was being done. I would think that there probably are other factors that may be relevant to financial sustainability. The statistical method that was used in the multinomial logistic regression to get the confidence intervals was a walled method. That's not the best to use when you have a smaller data set, but it's the only one that was available in R. So that's what I was able to use. And this was a survey that was sent out to birthing centers that the AABC knew of. So if they didn't know of them, those birth centers or midwives were not part of it. So, it would be great recommendations to look at a larger sample, measure more organizational aspects, and find out why these organizational aspects seem to have an effect on long-term financial sustainability. It would be very helpful to try to find out what things we can do as on a policy level to help birth centers grow and stay in business. And then we would like to find out more economic measures for the undervalued midwifery and birth center care, because a lot of the good outcomes we get are because midwives spend more time. And so how do you put a value on that extra time and attention being paid? And then of course use multimodal measures to ensure greater response rate, and maybe do some direct objective looking at birth centers rather than just getting all the information from a survey. And these are additional references. I'd like to thank the faculty at the University of New Mexico, my committee members, Dr. Lavin, Dr. Barger, Dr. Kelly, and Dr. Parshall. Everybody gave me great feedback and comments. And I also appreciate the financial support I received for my education from Johnson & Johnson, the San Diego Hispanic Nurses Association, and University of New Mexico's College of Nursing. So all of that is greatly appreciated. Thank you very much.